That is, we put a layer of vitamins to plump up these skin cells. And what we use is vitamin C, like a 20%, or a prescription strength retin A, and a vitamin A product. And also copper peptides are good, and alpha lipoic acid. So there are certain topical substances that can go in and plump up those skin cells to recreate the skin of children. And it is an amazing transformation. What happens also when we add these vitamins to the skin, such as vitamin C, vitamin A, which is retin A, copper peptides, is that the elastin and the collagen underneath it also gets stronger and thicker. So you see here, before it was weak, and then after it becomes thicker and stronger. And the manifestation of these is fantastic. So the products that you want to use are a glycolic acid on top of the skin here to smooth out the skin. After that, you want to feed the skin with a vitamin product. And the last product that you want to use is a sunblock, of course, is to protect what you've now created, what you've now transformed. And SPF of 30 and above is very, very important for everyone to use, and sometimes you have to reapply it once or twice a day if you're going to be out a lot. And that's going to prevent sun damage and discoloration. Most discoloration comes from exposure to the sun. That's why most people don't have discoloration or brown spots underneath their jaw. It's mostly on the cheekbones and other sun-exposed areas. And after you use your sunblock, you can also use a nice moisturizer at night to keep what you've now transformed nice and moist and supple. So basically, these are the 3 or 4 steps that are needed to create this skin that is a 35 or 45-year-old skin back to a beautiful, young, smooth, healthy appearing skin. My name is Dr. James Kojian. Thank you. Hi, I'm Dr. James Kojian, a board-certified physician. I'd like to take the next 5 minutes to talk to you about weight loss. The medical concept of weight loss is that we like to have a situation where we're creating a low insulin level in your body. By maintaining low insulin levels, that is one of the major key elements in keeping your appetite suppressed and preventing any amount of calories and glucose from being transformed into fat. One of the ways in which we also can use medication to suppress appetite is by using phentermine or other FDA-approved products to help you control your eating and to suppress your appetite. By the use of a medication for a period of 4 or 5 months, it will enable you to eat less. And what will happen is, as you eat less, the stomach will eventually start shrinking. Because now for 4 or 5 months you will have been eating less. And because the stomach is a smooth muscle, it can expand and it can contract. By eating smaller portions for 5 months or so, the stomach will get used to eating less. And after you go off the medication, you are less likely to eat more and to overeat, and you will be less likely to gain weight. When you get off the medication, your metabolism does not get lower like having a diet that is very calorie restrictive might do. It has no negative effects, and it can't cause any long-term damages because it is FDA approved. Phentermine and a lot of these other medications have been on the market for many, many years, and the amounts we use have been proven to be safe in human beings. When you combine weight loss medication like phentermine, it will suppress your appetite, raise your metabolism, and this in and of itself will lead to weight loss. As you harmonize and combine that with a low glycemic index diet or a low carb diet and exercise, these three things together will allow you to lose very consistent and safe amount of fats for long-term results. And this is the safest way to lose weight, where you're not being forced to rely on pre-packaged meals. You actually have to learn how to eat better, such as high protein and high vegetable menu of diet. And you want to learn how to eat less carb and less sugar. And it's going to also train you and teach you and motivate you to carve out 3 or 4 days out of the week to exercise. And these habits that you will learn are going to sustain permanent weight loss in you, so that you're not hungry all the time, and you're going to metamorphosize your body from being softer and rounder to being firmer and toner, and bringing out that shape that is already in you. I'm Dr. James Kojian. If you have other questions, please feel free to contact the employees of the office. Thank you.